Hello everyone, my name is Ashish Rahi, Assistant Professor RP Institute of Pharmacy, and today my topic is about irritable bowel syndrome. The irritable bowel syndrome is a gastrointestinal tract disease in which the affected part is your colon. The colon is basically large intestine in which cause cramping, abdominal pain, bloating, gas, diarrhea and constipation. Epidemiology of IBS is 3 to 22% worldwide. The reason is gastrointestinal vision among children with recurrent 26%. Abdominal pain onset before age 35 is 40% or age between 35 to 50%. What does the colon do in IBS? The contraction of the colon muscles and the movement of its content is controlled by nerves, hormones and impulses in the colon muscles. These contractions move the contents inside the colon towards the rectum. During this passage, water and nutrients are absorbed into the body and what is left over is stool. Here you can see that there is a contraction of the colon which cannot pass the stool towards rectum and the bolus move forward. The contraction pushes the stool down the colon which causes the bowel movement. But in IBS there is no bowel movement. इसमें होता क्या है? Bowel movement stool आगे पास नहीं हो पाता contraction की वजह से and the muscles of the colon do not contract in right way that the colon do not move correctly which results the abdominal pain, cramps, constipation or incomplete stool movement or diarrhea. Here you can see the ultrasound image scan images of your normal colon and spasmodic colon, that is spastic colon or contracted colons, which causes the abdominal cramps, diarrhea. So this is the detail about the IBS. Thank you.